I'm Linda Baker, the Learning Director at the Center for Research and Education on Violence Against Women and Children. On behalf of the Learning Network and Knowledge Hub, I would like to welcome everyone to our webinar, Finding a Better Way, Strengths-Based Trauma-Informed Practice. Please think about the traditional lands you are currently situated on and join us in thanking the generations of Indigenous peoples who have cared for these lands and in celebrating the continued strength and spirit of Indigenous peoples. The ongoing work to make the promise of truth and reconciliation real in our communities, and in particular, to bring justice for murdered and missing Indigenous women and girls across the country, should inform our discussions in this webinar and beyond. I'm honored to introduce today's speaker. I'm just losing my notes here, but they're back. So I'm going to ask Jolie not to switch any slides until we get this part over, if that's okay. Dr. Jolie Sasakamoose is the interim co-scientific director of Natawehowin Art of Self-Healing, First Nations Health and Wellness Network, Saskatchewan First Nations and Métis Health and Wellness Research. I'm just going to, my screen keeps disappearing, so I'm sorry, I'm just going to start this again. Dr. Jolie Sasakamoose is the interim co-scientific director of Natawehowin Art of Self-Healing, First Nations Health and Wellness Network, Saskatchewan First Nations and Métis Health and Wellness Research Training and Knowledge Mobilization Network. She is the research director of Wellness Wheel, responsible for leading the research team in supporting traditional ways of knowing alongside Western approaches to well-being. Dr. Sasakamoose is a proud Anishinaabe with membership in Chiging First Nations in Ontario, an active citizen of Ataku Cree Nation in Saskatchewan, and an associate professor in educational psychology and counseling at the University of Regina. She co-authored the Indigenous Cultural Responsiveness Theory and has an exceptional way of working in the middle ground between Western and Indigenous ways. And I'd just like to share that in chatting with Jolie before the presentation, we learned that she is now avid in terms of ballet, in addition to her gardening. So she's inspired our team. We're now excited to look into ballet as well. So Dr. Sasakamoose, Jolie, welcome. We're delighted to have you, and I want to turn it over to you now.
Thank you so much. Today I'll be presenting a strengths-based and trauma-informed a way in which you can shift your current practice. And that practice, recognizing that there's over 3,000 people registered, could be in many areas, including education, health providers, could be frontline workers, organizations, non-Indigenous organizations, as well as Indigenous ones, First Nations communities, and the organizations within those. I'm hoping that what I present today will be able to meet you wherever you are and deepen your learning. Also, I have presented to the knowledge webinars before on the Cultural Responsiveness Framework. We've been using that framework now for about 4 years, and so we have a lot more evidence and a lot more experience with it that we can share with you today as well. I do want to note that this presentation will discuss trauma and grief and factors that contribute to it, and it may be triggering for some, so please be aware of that. The organization of the presentation, first I'll start with my own land acknowledgements and self-location. I'll describe the purpose of this webinar. I'll give you the colonial context specifically within Canada, but also bridging to North America and the States. A brief overview of trauma and grief, Indigenous perspectives of well-being and the Cultural Responsiveness Framework, And I'll talk about recovery from a strengths-based perspective, and then we'll have time for questions. And I'm very excited about having a full hour to present, because when we presented in the past, that was one of the recommendations, that we have more time to present and more time for questions and answers. So having a full hour to present allows me to get more rich and more deep for your learning. So I'm excited about this opportunity. So for my own self-location, it was already said that I'm from Chagin First Nation in Ontario. That's where my biological dad is from, and I'm a proud member of that community. And I currently live and work in Treaty 4 and 6, situated on the territories of the Nihiwak, the Anishinaabeg, the Dakota, Lakota, and Nakota, and the homeland of the Métis Nation. I am the current research director of the Indigenous Wellness Research Community Network and Wellnessville Medical Clinic. And I am currently getting ready to launch the Muskegee Musqueam Medicine Bear Lodge in the fall, and we'll talk a little bit about that later. I often say we because I look at myself as presenting with a team, even though my team isn't here. I don't work in isolation. I work with a very rich team of people. So, for this particular talk, the TRC calls to action, if you're not familiar with them, they're very important documents in Canada. And I would really suggest that you take a look at those calls to action. I'm assuming that most people on this call would be familiar with them, but if you're not, it's a very important document, because it's the first time that, as a scholar, as an academic, that I've had something with real teeth that I can actually ask and to hold people accountable to and for. So the TRC calls to actions are the words of our elders who attended residential schools, and they came up with recommendations for all Canadians to enact. And so when people often ask, what is it we can do? I say, read the calls to action, because the elders have spoken that for us. So as I said, I'm going to give you a bit of the colonial context. Now, this is where some of the trigger warning comes. And what I want people to understand is that I'm going to present a skiff of colonial context, a schism, barely any information. It's a good opportunity for you to take notes on whether or not this is new information for you. And if it is new information, you may want to go and investigate more deeply the different things that I'm going to share with you. Some people go into disbelief if this is the first time hearing it. They're not able to digest it. So I just tell you this so that you can be mindful in your own experience of what you're hearing. Recognize I'm not doing any one of the things justice by just telling you the high level piece of it, but that if you want more information, you should do a deep dive yourself. So in Canada, there's a very profound experience for Indigenous people within the context of history. The relationship is filled with colonization, and it includes many, many different factors under there. And so I'm going to give some examples. An example of what happened in colonization was something called the pass and permit system. First Nations people were relocated and confined to First Nation reserves and not allowed to leave without a pass from the Indian agent. So it's kind of like in high school, you want to go in the hallway, you need a pass. It's a very paternalistic system. Imagine a grown man, a father, can't leave his reserve, mother can't leave her reserve without a pass from the Indian agent to go to town, to get groceries, to take care of basic necessities in life. In addition to that system was another system. If you wanted to work for some of the companies in Canada, such as one of the hydros or any of the major companies, you had to give up your treaty status and terminate your relationship with your First Nations community, which then obviously altered your identity and your ability to be around your own community members. So that's just one other piece of colonization. Most of us on this call should be aware of the residential school system, both in the United States and Canada, and Australia and New Zealand. It was a planetary problem. And in that residential school concept, the whole idea was to stop the Indian from being an Indian, to take children who were kidnapped away from their families, put into vans, buses, and shipped far away from their home community. Often parents didn't know where the children were when they went to school. I actually wasn't as aware of the families not knowing where the children went until some of the most recent discoveries of children's graves being found in the residential schools around Canada. And then I learned that parents family members were coming from all over the country to certain residential school locations to see if their family members who were never families were never told their children died. They didn't know where they were. So family members were coming forward, looking at all of these locations where children are being emerging from discoveries to hope that those are lost family members. There's also the restricting of the involvement in the economies in the land. If you can't leave your reserve without a permit or a pass, you're likely not going to be able to be involved very well in the economy or in the lands. And this also led to political marginalization and bureaucratic and technocratic control of every detail of Indigenous lives and bodies. And then I'm going to talk more about this in detail after, but there's a lot of medical experimentation and the use of Indigenous people as research subjects. Some of Canada's history with the Indigenous peoples has been racist and paternalistic. It's been used to promote and legitimize a racist ideology rather than help communities or individuals. It's often been used to capture the exotic native, a lot of social Darwinism. It's often deficit-based. The data is normally used against us. There's a lack of access to various kinds of care. In terms of research, research has been exploited. There's been something we call helicopter research, where researchers come in, extract what they want, helicopter out. They often don't leave the data behind. They don't come in with consent or ethics. This is at the university level as well as the level of governments. There was also an introduction of diseases such as smallpox, where in the United States, blankets were given full of smallpox to First Nations community members so that they would get sick and die, such as measles, influenza. Indigenous peoples have faced famines, epidemics, and now we experience violence, suicide, high rates of addictions, accidents, high rates of HIV and hepatitis C. Here in Saskatchewan, we have the highest rates of HIV and hepatitis C in the country. And it is mostly due to colonization and the problems with that. And then there's this whole issue I'm going to spend a bit of time on about the violation of human rights with medical experimentation. And I'm going to speak to that because it's a great example of why we had some of the challenges with vaccinating and with COVID. Because of medical experimentation and the dehumanization of Indigenous people, such as nutritional and medical research experiments conducted on residential school children and forced sterilizations, my own mother being one, forcefully sterilized at 25 with a full hysterectomy. These procedures have led to medical and research distrust. I just need to move a couple things around my screen here, sorry. Nutritional experiments were conducted on children in residential schools and in Indigenous communities between 1942 and 52 in Canada, and included the following. I'm only giving you a couple examples. There are a lot more out there. You can do a deeper dive on this if you're interested. And you can also read James Daschuk's book, Clearing the Plains, because I believe he discusses this. In 1942, there was a study in 5 northern Manitoba Cree communities. This study involved physical examinations of Indigenous children. They were given blood tests and radiographs. Children who were taken away from their homes. My son has barely had any blood tests. He's 9 now, and he's terrified to get a blood test. I cannot imagine children in residential schools with no parents being mistreated and then forced to go through physical exams, blood tests, and radiographs by adults they don't know. Researchers commented on how profound the malnutrition and near starvation was. In 1947 and 48, in James Bay survey of Attawapiskat and Rupert's House Cree First Nation, the study involved physicians, a dentist, an X-ray technician, a photographer, and 3 anthropologists. And the study aimed to examine the nutritional status of First Nations children and provide guidance. Sorry, this is my slides are. Sorry. This is blocking my. There. The study aimed to examine nutritional status and provide guidance regarding combating not only of malnutrition, but also the threat of Indigenous dependency. What's really frustrating about these studies is that they're studying malnutrition, but they're not doing anything to stop the malnutrition. They're just noting it and studying it, but did nothing to fix it. It's angering. Why I'm sharing this with you is because it's had huge modern day impacts on COVID-19 vaccine hesitancy in our region. I was asked by the Saskatchewan Health Authority to help support a vaccine uptake with elders and marginalized people in the Treaty 4 area. And so when we started to put together that program and what that would look like, when we started to talk to the elders, they had a lot of memory from this particular study because this happened in our treaty area. It was the trials of the Copel vaccine. In 1933, there was some fear of disease transmission from reserves to settlers. So the TB vaccine was only open to high-risk people and the sick. So having gone through a pandemic, many of us now understand what this means. Despite protection and efficacy concerns, the Department of Indian Affairs backed experiments with the TB vaccine. Infants were given doses and additional infants were chosen as a control group. And despite the vaccine shielding most infants against the disease, almost 1 in 5 from both groups, control and experimental, died of poverty-related illnesses. And what this showed Indigenous people, First Nations people, is that vaccine success does not erase the concerning motivations and methods of the trial and the implication that Indigenous lives are considered of lesser value and that we're just good to experiment on. This left a very sad and dark and traumatic history that we had to overcome in order to get our elders vaccinated. I'm just going to speak a moment about trauma, because as you've already heard, these experiences were very traumatic. And so to understand what trauma is, I'm going to give you a brief overview. But I also want to recognize with over 3,000 people on the call that you each come from a different background, a different experience, and that each one of your fields likely has its own trauma-based literature and possibly even training. So for example, yoga teachers have their own trauma-informed yoga practitioner training. If you are an educator, there will be trauma-informed educator training. And I encourage you to look at your profession and at the trauma-informed practices around your specific profession, because I'm only going to be giving you high-level information today. So in general, what is trauma? It's an experience or set of experiences that overwhelm an individual's ability to cope or integrate the ideas and emotions involved in that experience. In other words, it occurs when the normal fight, flight, or freeze reactions are inaccessible or ineffectual. This could be a single incident. It could be developmental. So what I mean by that is what happened in residential school, trauma throughout the development of the child. So that has severe implications as a child is moving forward in their stages. There's complex trauma. There's intergenerational trauma, which I'll be speaking to in much detail, and then historical trauma. With trauma, anyone can be traumatized. No one is immune. It is widespread throughout the world. It affects every part of the population. And numerous studies, such as the Adverse Childhood Experiences ACEs scale, suggest that at least 75% of the world population has experienced at least one traumatic event in their lifetime. That study was pre-COVID. I can only imagine that it's even higher. And if you kind of look at what a traumatic event is, you would see that probably most of the population has experienced at least one traumatic event. Excuse me. This slide I like to share because it really shows that how trauma works. So trauma is the physical or emotional threat or harm, unable to predict, to prevent, or escape. And it impacts our nervous system into fight, flight, or freeze. And it's at that moment that you either are able to stabilize and self-regulate, or you are not. And if you are not, then you move into sort of deeper consequences, which over time could have physical, mental, and behavioral troubles. If you are in a one-time trauma, it is likely that you can stabilize over time and get back to recovery. If you're in a complex or cumulative trauma, or example of residential school, consistent trauma over the lifespan, you are not able to stabilize or self-regulate, and you move into deeper problems that affect the physical, the mental, the behavioral, relationships, community, spirituality. One of the things I would encourage you to do if this is interesting to you is look at that ACE scale, which I cited in the previous slide, because the ACE scale reveals that if you have a score of 6 or higher, I believe, that you will likely manifest in your adult life in several of the chronic diseases, including cancer, diabetes, heart disease, etc. That's not, doesn't have to be daunting that you're never going to get clear of that. If you're able to, as this chart shows you, at the point of trauma or after trauma, to stabilize and self-regulate, which means intervention. It usually means recovery of some type, depending on what your trauma is and how much work or support you need. So the whole idea of the nervous system being basically in chronic fight, flight, or freeze is important to note. If you're coming to this webinar and you don't understand those concepts, I really encourage you to look them up and understand what they mean and what they look like in a human response, because this is what you're asking for, is to become trauma informed. You will need to understand what fight, flight, or freeze look like. I like to change something at time. Okay. I really like Kurt Mayer's work. I've cited him at the bottom. He's an author of several works when it comes to healing and well-being of Indigenous and First Nations people. He is located in the United States. He is not Indigenous, but he works closely with First Nations people on both sides of the border. What I really like about this piece that he's done here is he really shows some of the pathways through which the effects of trauma and loss may be transmitted across generations through processes at multiple levels. And the reason I think this is important is if you start at the bottom of the slide at the individual level, and you think about, for example, we use residential schools. If you think about residential schools at that first generation where the children were forcefully separated from parents, the identity was denigrated, the culture was suppressed, there was physical and sexual abuse, that manifested in that first generation as low self-esteem, mental health problems, and difficulty parenting once they were out of school. We see that in our grandparents. At the second generation, that low self-esteem and mental health problems continues, and it goes into the third generation as well. And we're talking that first row, or that second row on the bottom across the generations at the individual level. When you move into the family level and you think about that first generation, so here we are, first generation, children are kidnapped off reserve. Imagine waking up on your reserve or your community the morning after the children have been kidnapped and your whole community is quiet. There's no children playing, there's no laughter, there's no breakfast you're making. So what happens to the family? Loss of children, grief, anger, helplessness. You know, many parents tried to get their children, tried to not send their children, tried to get their children back, and they were threatened with jail, basically. So that first generation is experiencing that loss, grief, and anger, but it's that second and third generation that start to experience family dysfunction, which can often manifest in domestic violence and abuse, likely due to the introduction of some kind of substances because they're trying to cope with the pain of the loss of their children. I just continuously ask you to imagine your child being plucked out of your life today, sent away to school, and maybe your child dies, likely does die, but you won't ever know until maybe 50 some years later when their bodies are discovered all over the country. At the community level, now you're looking at the loss of a whole generation of children. All your future leaders gone. Negative labeling and stereotyping happens to the entire community. The community disorganized. We have our own conflicts. We have a lot of social problems. So you can see in that second and third generation, now we're moving into fourth and fifth. This is what's happening. And as a nation, because we are nations, we have our own governance, we have our own power, we have our own systems, we have treaties, but those have been politically disempowered. We've lost our collective identity, and this is called genocide. And this is something Canada refuses to say to this day, and only signed on to UNDRIP, the United Nations Rights and the Declaration on the Rights of Indigenous People, I believe last month. This country has a lot of work to do, and so does the United States. I'm just going to talk about grief for a moment. I'm not talking about it from an academic perspective. This is based upon work with my Cookum, my grandmother. After my late husband passed away in 2019, she came to stay with me for a while, and we talked about grief and what grief was. And I just wanted to share this with you because in addition to trauma, a lot of what we're seeing in Indigenous people, but even across the country right now with everybody's response to what's going on with these graves that are emerging or being discovered at the residential schools. Like grief is a spiritual response that we have when we've lost someone or something of deep meaning to us. It is not an enemy, but a process of healing and restoration of wholeness. To grieve is an act of courage. And through mourning, we find our indestructible self. Mike Cookham talked about profound losses and accumulated grief. So basically, sort of like that complex compound trauma is that you have one loss and then another loss and another loss, and there's no space or place to grieve. So we have the loss of our family system and its values, our family of origin lost, our community, our land, our language lost. With children in placement, we often have multiple placements. They move frequently without warning. Often we can't form attachments. We become isolated in silence. Our losses are never addressed immediately, and most often never. And if you think about the age development influences on a child and what that looks like, and how children, how do they manifest a full and intact sense of self with this constant disruption in their lives? The other thing is the devaluing of children and ways of knowing. So, you know, Western ways didn't value children in the same way that Indigenous people, First Nations people value children. And the loss of respect of men and women and other genders. This whole issue of gender has come up in Western society. It was not an issue in our communities. All people, no matter where they fit on any of the spectrums, whether it be autism to gender, were welcome members of our communities and often seen as actually being spiritually gifted. So these people had a sense of respect in our communities. One of the things my Musham taught me, grandpa taught me about people with Down syndrome, for example. I remember being approached several times by out of the blue by people with Down syndrome. They would just approach me and want to be around me. And I asked my dad about that, and he said, they are the most sacred people on the planet. They are so close to God. And so you have to have the utmost respect for people who manifest in this way. And so I share that with you because the next slide that I'm going to share is, and before I share it, I'm going to offer a moment of silence when I show you the image, and then I'm going to discuss what the image is. This image, typically I wouldn't share something like this because it's actually a picture of a grave site. And in my teachings, we don't take pictures of graves or show them. However, in this particular context, I have permission to share this photograph. This is a picture of 751 unmarked graves at Cowessess First Nation. Oops, sorry, I didn't mean to do that. Let's go back to that. Cowessess First Nation announced a preliminary finding of 751 unmarked graves at a cemetery near the former Maribel Indian Residential School. The residential school operated from 1899 to 1997 in the area where Cowessess is now located, about 140 kilometers east of Regina, where I'm sitting today. Children from First Nations in Southeast Saskatchewan and Southeast Manitoba were sent to school, but when I was there that evening, I met people from Ontario looking for their relatives. So I think it goes beyond Manitoba. The First Nations took over the school cemetery from the Catholic Church in the 70s. Earlier in June, Cowessess started using ground penetrating radar to locate the unmarked graves. And this picture was taken by CBC, and I saw this picture in the BBC, ironically, and that actually happens to be my son hugging me and I, as we were, because we were at Cowessess that night for ceremony, and we were walking around, and it was overwhelming for both of us. So that picture surprised me when I saw it in the news, but definitely was a profound and powerful evening. I want to go back to this image for a moment because I can't express when we talk about trauma, and I've had my own trauma, but I'm nowhere near a residential school survivor. And yet to walk through these unmarked graves and to look at almost 2 football field sized pieces of land with unmarked graves, and I'm a gardener, so I plant in rows sometimes. And to see the meticulous nature with which these rows were created, this was not thoughtless. This was well thought out. So to have no records, I don't believe that. And the other thing I would say about this, because this is painful and profound, and I'm going to speak this truth today, one of the things I learned with the community while walking through here was each light that you see was a sonogrammed bones, definitely found them. But what you don't see is that every time that hole was dug up, there could have been another one burned on top of it, incinerated. So where you see 751 lights, you potentially could times that by 2, 3, or 4 or more. We don't know because the church didn't give us records. So when we talk about trauma and grief and rage, I didn't go to residential school here. I didn't go. But the trauma that my body witnessed and experienced from this is overwhelming. On this particular day, I knew this number was coming out. I didn't know how high. We had been called, so I am a counselor in town, currently getting ready to launch a new healing and wellness lodge, because during COVID, what we discovered was that all the resources that typically served marginalized people, especially in the urban areas, went away. Many of the cities experienced that due to COVID. Resources were shut down. So we started planning to open a clinic based upon the concept of supporting mental health and addictions. And in that process, we started to build relationships with therapists in town. So I started to get text messages about 3 days prior to the CAUSIS number being revealed, saying, could you and your team start to organize elders and therapists and counselors who are taking patients? Because we know that when this number comes out and this gets revealed, that Treaty 4 area people are going to have a hard time. And that is exactly what we did. We started calling, getting lists of people who were available, and then that number was revealed. And then those calls started coming in. And it has been an exhausting time here for us, for ceremony, for people, because of the pain of having 751 little unmarked graves right next door to you. It's a big deal. And it has waken up Canada tremendously, both Indigenous and non-Indigenous Canada. And I'll give you an example of that. So on this particular day, I was getting ready for the announcement to come out, and I got a flat tire after taking my son to school. So I drove immediately to the service center. And as the tire was getting repaired, I was sitting in the lobby, and I looked up, and Chief Catamist Delorme was announcing this. It's not the way I wanted to hear it, but I had no choice. So I sat there in the lobby and I listened. I fully expected everything he said. Nothing surprised me until he said the number 751. And for some reason, when he said that number, my body couldn't handle it. I felt like I was punched in the stomach. I started crying. I was having a trauma reaction right there in the lobby. I had no idea what was going on around me. At that time, there was a man to my left, well over 80, a non-Indigenous man, and he was watching, and he said to me, how could we have known? How could any of us have ever known? This is shocking. And I look white, I present white. So I said to him, I don't remember initially what I said, but then I introduced myself to him. I told him where I was from. I told him, contextualize myself as a Native woman. And we just started to have a real conversation. And he stumbled on his words. He asked if he was offending me. Could he use certain words? He didn't know what to say. And I realized that for two humans, we were having a hard time communicating because the word choices, the fear of hurting the other's feelings. He told me that his wife was a counselor her whole career. She never knew any of this had gone on. And at that moment, I felt that perhaps if non-Indigenous Canada would have known, that maybe they wouldn't have wanted this to happen. Maybe they would have tried to stop it. And then I later saw, just last week, a interview with two non-Indigenous Americans who came to work at a residential school. And they told their story of how they tried to inform and get this information out. But they didn't realize that this wasn't just their residential school. They thought that this was only happening at the residential school that they worked at. I wanted to share that video with you today, but due to the time constraints, I didn't. But I think it's an interview worth hearing, and they even published a book about it, and I didn't get the name of the book, but I can get that. Because to understand that they tried to intervene, they tried to share with the government, they tried to get the church to stop abusing their children, but they fell voiceless. And I believe that this is happening now in our own foster care systems. So we have right now more children in care in Canada, more Indigenous children in care than we had at the height of the residential school system. And so what's so frustrating and angering is the frustration and sadness that we're talking today about the residential school system. We're going to be having this conversation about the foster care system in no time. So this is grief. And I share this with you about grief because grief and trauma go hand in hand, especially when it comes to recovery. The present day impacts, the history of colonization has influenced the issues, the policies, and the procedures of the present day. I'll just give you an example. People ask all the time, what is it that we can do to help? I say this in the most simplest form. Help us smudge when we want to. What do you mean? That's so simple. Yeah, it is very simple, but help us. Look at how challenging it is for us to smudge. If I'm sad in a hospital and my husband's dying, which was happening, I can't whip out smudge and smudge myself. I can't smudge myself in a school. I can't smudge myself in any building. So if people want to help, then they need to allow us to have access to what helps us get well. And what helps us get well is our medicines, our language, our ways of knowing and being. And in 2021, with the Trc calls to action and damn near every single organization having a strategic plan that says something about indigenization, the fact that we can't do a simple act as such as smudging without asking permission and often being denied is ridiculous. The systematic suppression and elimination of our culture and our tradition has contributed to intergenerational trauma, the remnants of which are evident today in the elevated levels of social and mental health issues experienced by many Indigenous peoples. Colonization, coupled with historically traumatic events, has exacerbated historic trauma responses and related health concerns such as diabetes, addictions, cancers, and cardiovascular diseases. Our team uses a strength-based approach that shifts deficits away from the individuals and places them within the appropriate context of residential schools and colonizations. This is really important work, and I'll just give you one example. The data coming out on HIV and hepatitis C from our province, as I already mentioned, is the highest in the country. And it is not from white gay men having sex. It is from intravenous drug use in our province. Very, very clear that it's against drug use. And it predominantly impacts over 80% of the Indigenous population. The narrative that goes with that then is that all Indigenous people are drug addicts. That is not true. When you look and you contextualize that within what we have experienced over the last 250 years, it is not that we're drug addicts. It is that we are coping with genocide and the destruction of who we were as individuals and communities and nations. And that is what is going on. We are coping. We are in survival mode. And we are asking all people, Indigenous and non-Indigenous, to start to understand what it means to be trauma-informed and trauma-sensitive, and to start focusing on our strengths and our resiliencies and not our deficits. Some guiding principles in Indigenous ways of knowing. I'm going to share with you what orients our work as a team, and what are the guiding principles and ways of knowing, and what are the reasons for using these ways. So I'll introduce you to those perspectives and to the Cultural Responsiveness Framework. It's really important and sometimes difficult for non-Indigenous people to understand a relational worldview, but you really have to understand that from an Indigenous perspective, from a First Nations perspective, the land, the culture, people, families, communities, animals are all relational. We take a holistic approach. So the land has as important of a spiritual significance as a human, as an animal. We are all connected in that way. And it's really challenging sometimes for Western worldviews to understand that we might incorporate the land in our healing, or that we might involve an animal or a horse in something that we do. It's not a concept that's easily to digest. And in fact, if you look at some of the regulating bodies for counseling, they will object to the use of anything but Western evidence-based practices. And so it's a real challenge as a counselor when I'm training students who want to use other holistic approaches to not potentially put them in violation of the regulation body. The Indigenous Cultural Responsiveness Theory, which is now known as the CRF, the Cultural Responsiveness Framework, is a decolonizing, locally adaptable framework utilized to support Indigenous health and well-being. And understanding this framework will allow the practitioner to engage in actionable steps to create a practice that seeks to transform service delivery for peoples based upon their needs. I won't go into detail on the founding of the CRF, but it is important to note that the CRF was actually founded by knowledge keepers in Saskatchewan over 3 to 4 years of engagement with them. And they created a document that outlines very clearly some very concrete actions that people can take in key areas. They then asked me and another Indigenous scholar to create a theoretical model. And I thought that was so cute to have our elders ask for a theory, but somehow they knew that academics needed that to move this forward. And so Dr. Shawnee Pete and I and some other people, we spent a good year trying to write a theory, which is a very foreign thing to do. But we did, and we birthed that framework. And so that's a tool in the toolkit at the end of this for you to use. Last couple of days ago, I've been playing around with drawing out the framework. I've been struggling with it, and I finally think I may have gotten there with this image. I'm not sure. I want to take this to the elders and ask them their thoughts on it. So the elders have not necessarily approved this. This was more of a map of how I see the CRF playing out in a model. And so you have those 3 strategic directions of the CRF, which I love. They are, in this case, a little bit watered down because remember the CRF was created by First Nations people, very specific First Nations people who want very specific First Nations actions in their area. So this is the adapted version. If you go back to the original version, it will say not restore Indigenous, it'll say restore First Nations, and it'll be much more specific. But in this way, it's locally adaptable. So the 3 major tenets that I live by in everything I do is I always have this in my head, is what I'm doing restoring Indigenous community-based health and wellness systems? Is what I'm doing establishing a middle ground for engagement between mainstream and Indigenous systems and worldviews? Is what I'm doing transforming service delivery to be culturally responsive? And if I have those 3 things going in my mind in all ways, then I know that I'm operating off the framework. And the framework gives you a few other things, a couple other tools built into it that really lend itself to being not only locally adaptable, but also have protective mechanisms. And those protective mechanisms are first and foremost this creation of a middle ground and ethical space, which I'll go into a little bit more in the next slide. But it's coming from that trauma-informed and that strengths-based perspective. And then the other thing is that local adaptability. So with the framework, you adapt based upon the population you're serving. So whether it's a First Nation or a women's group or a school, the adaptability is because it's driven at the local level. And this is beautiful because most models are not locally adaptable, they're just models. But this one was designed to be adapted to the specific needs of the population. Middle ground is essential. Finding it is essential. And there's a lot of literature out there on the middle ground. It was Willie Ermine is a well-known elder here from Sturgeon Lake, and he is pretty much the trailblazer of what I believe is the trailblazer of the middle ground, or what he often refers to as the ethical space. And this was also a Supreme Court law case that talked about that ethical space. So if you want more information, you can certainly look up Willie Ermine's work or the Supreme Court case. But the ethical space is a cooperative spirit between Indigenous peoples and Western institutions in order to create new currents of thought. And in that ethical space, we often use 2-eyed seeing, which is to see the strengths of Indigenous knowledge and the strengths of, I say, evidence-based Western practices and bring them together. In the past, you would hear some people talk about straddling Western ways and Indigenous ways. But I got frustrated with that term because straddling does nothing for anyone. You do a little bit of this and a little bit of that. To me, what really became valuable over the years in working with patients and people is seeing that it's the harmonization that works the best. It's the harmonization of evidence-based Western practices with our cultural ways of knowing. And the beauty of harmonization is, and I always give this example. So for example, CBT is a form of therapy. It's an approach to therapy. It's often short-term and doesn't always have the best effects with First Nations people. But that is a tried and true, well-documented, probably the best researched therapeutic practice out there. I have my own theory as to why. My theory is that it's short and succinct. It came out of the United States, who didn't have health insurance. It was a quick and dirty way to get someone through therapy. 10 sessions, you're done and out. 10 sessions, when you've got the kind of trauma we have, not really useful. In general, that whole form isn't useful. So if you come into the ethical space and you harmonize and say, CBT is the way to go, and we're insisting you use CBT because it's got the best evidence, but it's not harmonizing with us culturally, then we toss it out. Doesn't matter how much evidence you have, we toss it out. It's not harmonizing. And that's where harmonizing to me becomes way more important than straddling. You can straddle all day long, but if you can't harmonize, you can just take it away and bring in something that works for us. And that's where I feel the best pieces of what happens with Western and Indigenous coming together is right there in that middle ground. In the past, I've talked about the CRF having that spiritually grounded perspective. I'm just going to review these quickly because the purpose of today's talk is to really talk more about the trauma and the strengths-based piece. But the CRF offers you a spiritually grounded perspective, which is one of the most overlooked aspects in its connection to the spiritual aspect of being human. Look at cultural connectedness, the holistic view of wellness, connectedness to family, and the integration of traditions and culture. So one of the things about the middle ground, when you're in that ethical space in the middle, you enact the cultural components or the cultural ways and protocols of the community you're working with. So if it's a Christian community and they want to pray, then you pray. If it's a community that says you have to come in and have a sweat lodge the first day before the meeting day, then you do that. However, that particular community or organization defines their groundedness. And at the end of the day, if you're working with an entity that it doesn't identify itself as spiritual, I bring my own into it. I do my own spiritual practices before I enter into anybody else's work, just so that I know that I'm guided appropriately. And then the CRF offers what I've already talked about, that community-specific perspective, that individual healing is directly connected to community healing, supportive initiatives, and subsequent evaluation that follows the vision of unique community based on the project, the community's needs, and the community's capacity and interest and engagement. The health of the community is linked to the sense of local control and cultural continuity. While this may be somewhat different in urban environments, it's still true at the community level. Now I'm going to speak more detailed about the trauma-informed perspective. What is that? First of all, practitioners in any field must consider the intergenerational impact of colonization and its associated negative impacts on the lives of Indigenous people. People must be aware of the causes and effects of this history in order to create programs that do not re-traumatize or perpetuate these systems. So we've already talked about intergenerational trauma. There's distrust of Western health systems, distrust of researchers, government, education systems. There's just distrust. So to expect non-Indigenous people to enter organizations or agencies or health systems that there's distrust doesn't always work. And so we have to figure out how we can get people through the door for help and support. But at the same time, if we're not coming to the door for help and support that you're offering, maybe your help and support isn't culturally aligned with who we are. And it's a good time for you to reevaluate your own systems and things that you have going on to be more culturally responsive, trauma-informed, and strengths-based. Right now, what I'm going to present to you is a way that you can have a trauma-informed practice regardless of your field. Trauma-informed services do not need to be focused on treating symptoms or syndromes relating to trauma. You can be an agency that has nothing to do with trauma and still be trauma-informed. Regardless of your mission, to deliver primary care services, mental health, addictions, it doesn't matter, housing, education, any agency can become, any organization, any human can become trauma-informed. The commitment is to provide services in a manner that is welcoming and appropriate to the special needs of those affected by trauma. And since we've already learned that over 71% of the population has experienced trauma, it's just a nice approach to come from. Sorry, just want to a trauma-informed service provider, system, and organization realizes that the widespread impact of trauma, understands potential paths for healing. It recognizes the signs and symptoms of trauma in their own staff, super important here, clients, patients, residents, and others involved in the system. If you have frontline people working in traumatic areas and you're not taking care of your staff, that's your first and most important team right there. They need to have well-being, they need to have social activities, their mental state has to be good. I train therapists. If I can't get my students to be healthy individuals, I don't want them seeing anyone, nobody. It's important that we reflect what we're asking of others. The organization also needs to respond by fully integrating knowledge about trauma into its policies, procedures, and practices. Now, this is a high skiff, high level, but there's a lot more information. Policies are really important when thinking about being a trauma-informed organization, and I would encourage you, if you're thinking about that, look to do a deep dive and some research on what trauma-informed policies look like, procedures and practices, so that you can rearrange yours to look similarly. And the core trauma-informed principles are acknowledgement of the recognition that trauma is pervasive, making sure there's issues of safety, trust, choice, control, compassion, collaboration, and again, here's that strengths-based piece. And the other thing I would just say is to make sure that your organization, you may do all these amazing, beautiful things. Your policies are great. You got this great staff, but maybe your front door person, your front receptionist isn't kind. Out the door. It doesn't matter how good you as an organization are if every single person within the entity is not breathing this philosophy, because one wrong approach, one wrong person can get someone to disengage from care or whatever service you're providing. I have so many examples of this, but I think I'm running out of time. I won't provide them. So to integrate these principles and systems in organizations, you should consider the following: power and control. I love this one because I often train healthcare providers at the nurse, doctor, the specialist level, it doesn't matter. And I finally got the answer about 2 weeks ago when I said, I just don't understand why sometimes healthcare providers can be so short and not even aware of the patient. And I was told by a healthcare provider, it's because that we are trained that the system is designed around us, our schedules, and our needs, not the patient. I'd never heard it that clear cut before. So, and that I recognize this is probably part of the challenge that I have, that when I train people, the entire system was designed around their control and not the comfort of those being served. So think about that have you ever been a patient? So explaining what, why, and how to your clients is super important. Doing with and not doing to is very important. Offering real choices, flexibility. This is key. This was key during COVID. If we didn't get good training and being trauma informed during COVID, I don't know if they'll ever pick it up, because I had to learn to be super flexible with my students, patient, kind, understanding as people were potentially having COVID, losing people from COVID. My father-in-law died the night I was teaching class from COVID. So, having compassion is a big deal. And again, I go back to understanding and being able to identify fight, flight, or freeze responses. Focusing on strengths, not deficit, which I'll go into shortly, and examining power issues within the organization and promoting democratic principles. Core trauma-informed principles are nonviolence, helping to build safety and skills, emotional intelligence, helping to teach people emotional management skills, having open communication, social responsibility, helping people build social connection and skills. We do this a lot in our work. You'll see shortly, we do a lot of gardening with our community members. We do all kinds of activities that help them get more responsibility in their own lives. Also democracy, helping create civic skills, self-control, and then growth and change, helping people work through loss and prepare for the future. The strengths-based perspective. Let's talk about what makes us well rather than what makes us sick. The thing about strengths-based is that we're often unaware that we all come from a deficit model. I think I try to be positive all the time, but I think I often come from a deficit perspective, and it takes work and effort and mindfulness to note when I'm doing that and to flip it. It's not just an easy tweak. Strengths-based is not a one-time switch. It is a constant work that you have to do yourself. I personally don't feel that you can be strengths-based at work and not strengths-based at home. You really need to live this stuff in order to have it manifest through everything you do. As people become aware of their own strengths, they are able to take control of their lives and make appropriate decisions to empower themselves. So strengths-based attempts to identify the resources an individual has in order to positively address problems. It's a model that focuses on developing assets. And sometimes I get challenged by this. For example, an HIV, well-known HIV doctor said, but HIV is negative. It's negative. I mean, how can it be strengths-based when it's negative? There's nothing positive about it. So being strengths-based doesn't imply that we should ignore the realities and the negative consequences just to focus on positives and be Pollyanna. No, 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 that's not what this is. Strengths-based facilitates healing by building on the pathways to resiliency. So what I said to that physician was, yes, we know that HIV is negative, but that patient who's First Nations is still here. That patient is a residential school survivor, is still here. That's a resiliency. Why are they still here? I'll give another example. And one of our doctors want to do a diabetes study. Want to go into a First Nations community and look at diabetes. Okay, we know why we have diabetes. We started eating processed food 25 years ago, and now we all have diabetes. Why don't you study, instead of why we have diabetes, look at those families in First Nations communities that do not have diabetes. What are they doing to keep that diabetes away from their family line? That's your study. That's strengths-based. That's what I mean about flipping your mind. It's going to take some work, and I have a couple tools in here that'll help you. I have this cycle here. When you see this deficit cycle that almost all of us are in, figure 1, you have a negative experience, you lower your expectations, there's often labeling that goes with it, which produces more negative behaviors. You focus on the deficits, more negative behaviors and labels. You see this in school all the time, especially if a child is labeled with ADD. You just go through this hoop, hoop, hoop cycle. The way to change that is, after the negative experience, you go immediately and identify the strengths. How did the person cope to get through it? Where are they at? Who are their support systems? What are their resources? And you continue to develop the strengths. You continue to develop the strengths that provide resources and support. You provide positive, valued, meaningful experiences, role models, mentors, whatever you can, opportunities for success, positive expectations, and then back around again and re-identify the strengths. It's a very different model. People have a hard time wrapping their head around it. But when you start to do this, you feel better. And the next slide I'm going to show you, I wasn't going to go over because it's for your toolbox, but I just want to spend a couple minutes on this slide, because as you read the strengths-based versus the deficit-based, I want you to note in your body the differences you feel. When you look at the words of the strengths-based, note what you feel in your body. When you look at the words of the deficit-based, what do you feel in your body? This is a conception chart for your toolkit. It's strengths-based versus deficit-based. So when you think about how many times do I say a day at risk instead of at potential? How many times do we talk about diagnosing instead of understanding, or reforming instead of adapting, or controlling instead of empowering? These are words that we use on a daily basis that we don't even know are deficit-based. And this is why I provided this chart, because we don't know we're deficit-based because the way we are trained in most academy, undergrad, grad, all training programs, we come from this model. Look for the problem, look for the diagnosis, look for the issue. We don't come from what are the potentials, what are the strengths, how do we engage, how do we move forward? These are words that you can practice and use in your everyday, even behavior focused. I've not been process focused, I've been behavior focused. So I looked at this chart and was like, I need to start looking at my own behavior around this piece. So I believe that in this chart are rich things that you can do to change your own thinking. Once you start changing your own thinking, then you can work on your organization or your home, then you can work on your wider community. But if we don't shift internally, there's nothing that's going to shift externally. It's a paradigm shift from examination of deficits to the discovery of strengths. I think this is basic, but almost every single person I present this to, this is a new thought. They've never questioned this before. It's an assumption when we come from a deficit. So start to think about the use of evidence as absent from the Indigenous worldview and value and culture, and think about Indigenous knowledge as the foundation for your evidence. A focus on individuals versus a focus on outcomes for families and communities. Strengths-based provides integrated models for funding and delivery of services. You can fund grants. You can. I do this all the time. Everything I write comes from a strengths-based perspective. People think you can't get there. You can't get funded if you're not deficit-based. I may have to include deficit-based things. I may have to include scales of anxiety and scales of depression, but I will also include quality of life scales. I will also include resiliency scales. I will show you step by step that every time you prove that we're more anxious, I can prove that you're more well because of our interventions. And that's the challenge that we have in the academy, is to get rid of this deficit base. Our elders have said, no more deficit-based research, no more. They're tired of it, no more. So if you take one thing from this talk, take that. Don't do any more deficit-based work with our people. I love this framework. It comes out of the Native Wellness Assessment. It's a really beautiful framework, and it just really shows the 4 quadrants that Indigenous, pan-Indigenous ways of knowing, that spiritual, emotional, mental, physical, and sort of how they map out and what gives us meaning in each area. So this is a really beautiful model to think about whenever you want to do anything for healing and wellness for Indigenous people. The Western approach really looks at wellness as the absence of disease. Indigenous models, holistic models, look at more the balance of the emotional, mental, physical. My old mushum, deceased late Noel Star Blanket, told me that the spiritual manifests through seeking balance between the emotional, mental, and physical. That is the spiritual. That is the journey. So it's all interconnected. You're not going to be well in one area of your life and not have an impact in another area. And I remember doing some research with youth, Indigenous youth, and I remember having this focus group, and they said so brilliantly, you know, Johnny, he looks so healthy. He's buff, he's handsome, but he drinks every night. He is not well. But you wouldn't know that by looking at Johnny. The children knew what health and well-being looked like, and it is not just the absence of disease. The other thing that's beautiful about strengths-based ways of knowing from an Indigenous perspective is it engages all generations in rites of passage and ways of knowing from pre-baby time all the way through. We have protective mechanisms and ceremonies and things that support us on the journey. Health promotion begins before pregnancy and continues with cultural practices that connect to the full spectrum of life stages to the newborn. These follow with rites of passage ceremonies throughout the child's life and into adulthood. I was so shocked when I started to learn that, you know, ceremonies that I thought were just meant for one thing, or practices that I thought were meant for one thing, really have deep healing mechanisms behind them. And I'll give one example. So I raised my son in what we call a meme, a Cree or Ojibwe swing. It's basically 2 pieces of rope. People will freak out when I say this. And in that rope, you drape a blanket and the baby lays in that blanket. And this was used in trees in the bush. I had one hanging over my bed. And so my son would sleep with that at night. And then when he would cry, I would just push his little swing. My kokum told me, my grandmother told me, she said, I'm so proud of you, my girl, for using that, because by using that swing, your baby will not have ear infections, because that movement balances the baby's inner ear fluid. Brilliant. Our people were brilliant and scientifically knowledgeable. And the fact that that was a protective mechanism and I didn't even know, that's the things that we need to restore. We have to get our protocols and our teachings back, and we have to get those healing protective factors behind them back into our knowledge systems. Moving into action. In order to adopt an Indigenous approach, there must be the realization that one homogeneous approach will not be all-encompassing due to the diversity and complexity of community and cultural contexts. However, guiding principles are present. The CRF model provides an overarching framework to plan, develop, execute, and evaluate programs to support Indigenous peoples. Adhering to the spirit of this framework will begin the process of decolonizing programs in order to better assist the needs of Indigenous people. This means that investing in its culture as foundation, culturally based, community-based, and land-based programs. One of the elders that I've worked with in the past said this: if you cut corners with ceremony, it shows that you will cut corners with everything else. That's deep. If you get that, that's deep. So I honor that, I acknowledge that. So my question for you is, for community-based practices, how do you build relationships? How is the community and the program staff engaged from the outset and throughout? And how are principles of reciprocity implemented? Engaging in action. I'm going to share with you ways in which our team engages in action. We have collaborations and partnerships. The true, authentic Indigenous approach involves relationships with people, from Indigenous partners, leaders, and populations being served. So from everything we do from inception to completion, our team looks like this. Any attempts to improve Indigenous mental, emotional, spiritual, or physical well-being must involve co-participation from the community members for whom the program or interventions or services are designed. I know this is hard, but there's nothing more frustrating than to be in a Western institution and to have non-Indigenous people create something, spend a lot of resources and money on it because of their lovely literature reviews and all the searches they've done. And then to see that resourced program fail because all the Native people are over here thinking, what are they doing? Why haven't they asked us if we think this would work? And I see it over and over again. Had the two come together in a middle ground space and use those resources together, we would have a lovely program that would work. We don't have that. So when you design a program, work with the community to plan the program and the evaluation in the context it should be offered. For your data, community involvement for the data and for the interpretation of the data if you're doing an evaluation. And all work must be used to produce a direct community benefit. If it doesn't benefit the community, and I'm not just talking Indigenous community, if it doesn't benefit the group, the organization, the people, why do it? Ask that question. So some of the things we do with our community, we do urban gardening. We had a volunteer team that got together. This is last year's pictures. Our gardens are actually expanded now. We have way more gardens. We have a full Métis garden with the Métis Local 33 and 34 here in Regina. It's doing beautifully. We have gardens, we have hydroponic gardens, we have just you name it. We're doing all kinds of things. With COVID, what we discovered was we couldn't get into community to pick medicines. And we got permission from our elders to start growing aeroponically and hydroponically. We also learned a lot about the strength of the medicines that we grow in water versus in nature. So that's another workshop, but lots of lessons learned there. When we started doing this, we started looking at how our elders didn't have access to traditional foods and medicines. We started doing an elder care program with them. And so we just started like harvesting and bringing them foods and medicines. And it was really fun to see the elders respond in the ways that they have around this service that we were providing. And we started teaching people about food security and having shelf-stable food, what that looks like. I didn't even know what shelf-stable meant pre-COVID. Now I'm an advocate of it. We like to expand capacity within community. Excuse me, I often won't, when I do anything, like when I start an initiative, I always then have somebody replace me who's Indigenous and paid. Usually I start initiatives for free, but by the time I'm done, it's a funded position for an Indigenous person. And so when we talk about expanding capacity, that's what we do. So we've taught people how to dry food, how to can. I actually have extra canners in my house. So if anyone in the community wants to can or dehydrate, they can come and check out a canner. The Indigenous ethic of care and resilience. I use this chart a lot because this is what happened when COVID hit. We started restoring old ways. We moved to traditional practices, hunting, gardening, farming, harvesting, preserving. We put new paths, new ways for old ways. We had webinars, online discussions. We're trying hydroponics and aeroponics. That's new stuff for us. Community empowerment, on reserve and urban responses, in addition to the measures communities are taking to prevent the spread of COVID, have also been initiatives to care for individuals who in many cases are dealing with states of emergencies on best days. So what we learned was when our communities were in crisis, that the best way that we could respond, especially the matriarchs in this treaty area, was to do. I think when I said this, someone quoted me once, it said, we're used to being disrupted, Indigenous peoples. You just saw like an hour's worth of talking about disruption. We can handle disruption. We know how to act when we're disrupted. We get out there and take action. What I saw during COVID in the beginning was a lot of people who aren't used to disruption, panicking, freaking out, trying to get toilet paper. I think that Indigenous people are strong leaders in a lot of areas. We have our own resiliencies and our own ways of moving, and a lot of people in our treaty area are actually following Indigenous leaders, the non-Indigenous people, because it was our chiefs in Treaty 4 during COVID that actually had their stuff together about how to take care of the people. In summary, the principles of Indigenous healing and well-being are very dependent upon the Indigenous group, which we all know is a lump term, I'm really speaking about First Nations, Métis, and Inuit in this country, which can vary considerably. Working with community partners based upon whatever project or service needs you're doing, the community's needs and capacity and interest and engagement need to be taken into consideration. There is not a cookie cutter approach, which often contributes to hesitancy among people who want to do things in a good way. There is a simple solution. Ask your Indigenous friends and colleagues, and if you do not have any, then that becomes your first step. And with that, I will invite you to access these tools at the end of this talk, in addition to any of the references that I provided in the talk. These are just some key publications that we have, and you have the link to the Cultural Responsiveness Framework as well.
Jolie, thank you so much. I just want to share with you, because I know you've been focused on presenting, that your talk, people have shared how much it has inspired them. People are asking when is part 2, and lots of questions about accessing more training for organizations, etc. And I think that when people are inspired and when it just resonates with them, then they want to share with you some of the challenges they face and hear from you how they might address those. So if you're open to that, I want to share some of the questions that have come in, and I think people just want to hear your thoughts about some of what they're facing. So here's one. And it's in response to the strength-based approach. What about when you're providing services that are about verifying deficits in order to help people get disability, benefits? Try to figure out how to reconcile the two. And I think the question is, do you have any words of wisdom about someone that is their role?
I think, because I write grants, so I have to present the problem, and I have to, usually use deficit-based instruments. But I think that, to do the service to the patient, they need to look sick to get benefits, right? So you can't. So I think what's more important is not necessarily that you don't ignore the realities. This is not ignoring the realities and making it Pollyanna. I said that. You put the realities down there. This is negative, but the strengths are in how they're coping. The strengths are, what are their resiliencies to get them through this, which has nothing to do with whether they're funded or not. What can that person do to support their journey? What resources can you give them to bring out their artistic talents, or to, engage them in activity of some kind, or maybe introduce them to an elder, or, it's those kind of supports. When you're talking about the government, look, I've been trying to challenge the government I'm 52 now. I'm exhausted from challenging the government. It's not getting very far. You see what happens to our high-level leaders when they do challenge the government. So I'm not necessarily saying go and challenge these organizations and institutions. What I'm saying is support Indigenous people and getting access to smudging, getting access to your culture, getting access to your ways of knowing. One of my students, most of my students are teachers or frontline workers, because I teach in the master's program, and one of them said, well, I had this student in my class, an Indigenous student, and she was so upset and she wanted to do this and that, but I didn't know how to help her. And I said, can you smudge in your school? And she said, no, the student always wants to smudge, but she can't. So I said, become an advocate for that. You be her voice, you advocate for smudging. That's what you can do. So I think there's things that you could look at. Is there a place of advocacy for you? Is there some terminology that should be strengths-based that you could advocate for and take it to the upper level? But I'll often caution people, someone said, like, what should we do? You can only do based upon who you are and where you are. So are you positioned to do anything? Because my mom isn't positioned to do anything. My cookum isn't positioned to do anything, but are you? And where are you positioned, and how can you use that? Some people are paralyzed. They're finding out about these residential schools and they're in shock and trauma. They're not going to be able to do anything. So they need to take, you know what I mean? So what you do depends on who you are and where you are and what you're willing to take on. And the other thing is your own self-care. Because I'm guilty, a lot of Indigenous women are people, but women are guilty of save the community, and then we're over here dying, we're over here sick, we're over here not well and not sleeping. So as much as you're advocating, are you taking care of yourself and modeling that in your own well-being in your own life? So those would be my recommendations.
Mm. I just, when you were talking about the smudging, I wanted to share, Jolie, that one of the participants shared that in one situation, an institution that was providing service said, yes, of course you can smudge, but there was no space. So, so it's sort of, there was a permission, permission's the wrong word, but there was acceptance, I should say, perhaps. But it, and they were able to find an outdoor space, the participants shared, but only because of COVID. If it hadn't been COVID, there wouldn't have been that space available. So just again, the layers in terms of barriers that people are experiencing. Here's another one, Jolie. Mainstream narratives often focus on resilient stories or examples in a way that invalidates some of the real challenges of communities, almost to say, see, everyone is fine. These narratives, coupled with a lack of systems data on disparities, it can become difficult to change these narratives of communities are doing well. So I think this is I'm just going to leave that for you to respond to.
Well, I haven't heard a lot of communities doing well. You know, like I know there are some communities doing well, but in general, if you do a little dig, even a community that may be doing well economically still has high levels of addiction and poverty. So, you know, I guess it depends on the scope of what you're looking at. Yeah, there's lots of communities doing well in certain areas, but there's always room for growth too. I remember, you know, I'm a counselor. I counsel people, and I've had many clients say, I was a residential school survivor. Nothing happened to me. I'm fine. It's fine. And so I asked, okay, well, how are your children? Oh, my son's addicted. My daughter's in prison. Oh, this, oh, that. So sometimes we don't see the own disparity because we can't, right? So again, that's what I'm saying. Like, strengths-based is not ignoring realities. Don't ever think that I'm saying that. Strengths-based is discovering the resiliencies within the oppressive factors that we've had to deal with, and how did we overcome them, and then sharing how we overcame them with other First Nations and Métis and Indigenous peoples, so that we have tools that worked with in our way. That's what that really is.
And I think that's just the perfect way to segue into this next question, because it builds upon that. So how do we critically examine barriers from a strength-based approach?
So again, I don't know why people think it's not ignoring realities. You state the realities. You hear me. You don't hear me say the government's great and we're all happy. I'm not saying that. I am on it. I am on the government. I am on the problems, but I will find a healthy way for my people to get through them. Do you understand the difference? It's not going in saying HIV is great and we're all great and we're all going to live and we've got PrEP and we can take that. Oh, it's great. It's not saying that. It's here's the reality. We have the highest rates of HIV in this country, but through cultural-based programs, through strengths-based programs, we can change the face of that. Through getting interventions for girls and women, we can change the face of that. That's the strength. It's not ignoring the reality. So I really hope people do not take that I'm trying to say these realities don't exist, because you ground yourself in those realities. It's what gives us the passion to keep going forward, is knowing that this oppression is going to stop because I'm going to use something strong to change it. Not that it's just all happiness. It's not that at all.
I think that's really helpful, Dr. Sasakamoose, because I think that often critics of strength-based approach, they even use language like, well, how does it help anyone just to put rose-colored glasses on? Or they have comments like that, which I think shows a misunderstanding of what's really meant by strength-based. And I think you're capturing and helping to clarify that in a really helpful way.
Also why, as a leading Indigenous health researcher in this country, I will use the ACE scale. It's deficit-based. I will use depression scales and anxiety scales, but side by side, I will use resiliency and quality of life and other scales. And then when I present my data back to the non-Indigenous grant holder, I will say, you wanted this, but I'm showing you this, and look at look at what we found. And then we find it and we contextualize it with qualitative data, and our experience is way deeper, rich, and more meaningful. Does the granting agency care? No. No. But my people do. I've given them what they wanted. They've got the scales, they've got their data, but now I move this piece forward. So sometimes you have to ride this is a straddling, this is not a harmonizing. You do have to straddle. If you're in that position like I am, where I can create and write grants and take and extract from non-Indigenous things to get to my people, and then interpret and then give them back. I'm a two-eyed seer. I'm a communicator. I take that and I massage, give back, right? They hear what they want to hear. My people get what they need. Do you see what I'm saying? It's a middle ground space to be in.
Right. I think that differentiation between straddling and harmonizing is really helpful. And I think sometimes straddling is seen as positive. And as you're saying, in some situations, it is the route to go, but not to mistake it for harmonizing. And that when there are opportunities to harmonize, then this is what it means. And that's what I think the culturally responsive framework is so valuable for. People had a lot of thoughts. You mentioned that a few times, references to children, references to child protection services, and some of the historical pieces, some of the ongoing pieces, some of your predictions about what we may be hearing more about in the future. And one of the questions, there's a number related to child welfare, and this is the one I'm going to start with. Do you have any suggestions on how to help child welfare workers understand that trauma-informed practice does not eliminate the trauma that is created by virtue of the context in and of itself for some individuals?
Oh yeah, just having a trauma-informed practice isn't going to take trauma away at the door. It has nothing to do with, the two are not, they're unrelated. You as a trauma-informed person, that's your walk, your talk, and how you are, but you're walking into an experience where trauma exists. Trauma is still going to pop up. It's just in how you can approach it and be aware of what you're seeing. A lot of times what happens in schools, for example, Johnny runs under the desk and starts screaming, and you think Johnny's being an asshole who needs to be taken outside or the principal's office. But all Johnny needs is for you to get under the table, regulate your breathing, and ask Johnny, do you need to go outside? You want to go shoot some hoops? What do you need? What do you need? And then de-escalate the body experience of the client, patient, child, whatever. So it's not about, the two are not really, they're not the same at all. One is how you are trained and how you practice to handle what's going to come your way, not flip what's coming your way. How do you handle it? That's the difference.
Another question is, I'm an Indigenous social worker that is creating a PowerPoint for First Nations communities to help them understand trauma. But how do I make it so that it does not re-traumatize clients or participants that are hearing that presentation?
Yeah, that's a tough one, because the stories we carry are so painful. And so even if you provide space for people to share, so when we do highly traumatic events or things where trauma can come up, we often will utilize, say, resolution health support workers or support workers around, like we might have 2 or 3 situated, so that when trauma erupts, someone can take that client, that patient aside and work with them. Because that happens a lot, right? Like you can't necessarily control trauma responses, but I would be careful. I would ask, suggest, like, is there a different approach? Like, you don't need to go into like I went into traumas today and I did put a trigger warning, but if I were to do this with, say, I knew that this audience was only residential school survivors, I would not have put the photograph of Maribel. I would have backed up my language. I would have treaded much more lightly to avoid that. So, it depends on what you're doing and why and who your audience is. Like, it's a very delicate dance. So I would just encourage her to maybe get therapists around if this is kind of like a provoking workshop where you gotta like hammer down what's going on, or if it's more just information, lighten that information up, provide your tools, your skills, and your resources, and just kind of leave it at that. Just depends on what the outcome, what the workshop's actually for.
And to think about what supports can be built in. Because I guess what I'm hearing you say, Jolie, is that you can never guarantee that you're not going to trigger or re-traumatize, or that someone's going to experience re-traumatization. Therefore, perhaps the best thing we can do is make sure that we give trigger warnings, that we're there with the supports, and that are culturally responsive for individuals that are there. There's another one that's related to direct work, and an individual shared, I recently started work in palliative rural outreach as a social worker in British Columbia. Much of the area has several reservations within the geographical catchment area that this person works. And is there any additional learning that you would recommend for my practice and working in this field, that is the palliative care field?
I believe it's Dr. Carrie Barassa here out of, she's out of U of S now, who does work in palliative care with Indigenous people. And then I would also, just try to connect locally. I'm sure that some of those First Nations communities have rites of passage, ceremonies, elders, protocols around death and dying, that if she could connect in it, just even look at if there's any organizations, even a tribal council, call a local health center, call a health center on a First Nation, and just start exploring. Do you have any programs for death and dying? What do they look like? Who might run them? Do you collaborate with the other communities around you? How might you link into them? I'm sure there's work being done, and it would be great to tap into those resources with relationships. You gotta be really careful about cold calling Indigenous people, because I'll just give a small example. I was cold called for a major organization, like emailed and asked me to be, it was like, we want you to be on our TRC task force, white organization. And I was like, I got a lot of things on my plate. Who are you? Why do you want me? What's your scope? Am I the only Indigenous voice? What's your terms of reference? Is there remuneration? Like, all kinds of questions. And then they were basically didn't really respond, and then sent another email with the task force date, time, Zoom call, and my name. And I'm like, no, you don't get to do that. You have to have a relationship with me, ask me out for tea. Maybe I'd want to take on this daunting task, but I'm not interested. So I think before you ask of others, you should, do a little climate assessment of what you're asking, because Indigenous people often do get, especially this time, we're getting, I'll just give you another example. Like our frontline organizations offering counseling for what's happening with the children's grave sites. It's causing a lot of trauma. And so a lot of the frontline organizations are taking walk-ins. A lot of the walk-ins are immigrants who are learning this after learning what they learned when they came here, right? They learned that we're, all the stereotypes, and now they're learning like, oh my God, so they're traumatized. And then non-Indigenous Canadians are traumatized. And we're actually having to put signs up saying, like, right now the services are really for this population. So really be clear about when you're asking an Indigenous entity or agency of something. Typically that reciprocity piece is important. When we ask something of something, we give something. So think about that when you're cold calling, but try to build some relationships. That's going to be the most important thing, because once you have an Indigenous partner, ally, friend, guide, then you're supported. And that's what we want. We want that ally who can sometimes speak when we can't, or we're exhausted. It's a team. We have allies on our team, and we have Indigenous people on our team, and we can't do one without the other. So build your team a little bigger, get more support, start working with Native Indigenous undergrads and grad students, build their capacity, offer something back to the community, so that the community has a benefit from what you're doing, would be a recommendation.
Right. Such words of wisdom. I just am looking at the time, and I'm afraid our time is up. A couple things I want to say before I thank Dr. Sasakamoose again. I want to just remind people, there have been so many questions about can we use this, tools that Jolie shared? And I just want to remind you at the end of her presentation, yes, that's why she has, and I'm sure like everybody else, she always appreciates if you acknowledge where they're from. That's always very helpful. But she's giving permission to that. All the questions about, will this be available? I want to show it to other people. I want to show it to my organization. I want to show it to our leaders, are some of the comments that we've had. Yes, thanks to the generosity of Dr. Sasakamoose, we will be able to post this on our website. And so the recording will be available. It's usually a few days following this. And I want to remind you that there will be a link in the chat box that takes you to the evaluation, because there's been lots of questions about, I truly learned and I would like to have something that acknowledges that I participated in this. And that's how you get it. Fill out the evaluation, and your name isn't connected to your comments, but that does allow a certificate of participation to be generated for you. And we're keeping a copy of the chat and the Q&A, and we'll share that with Dr. Sasakamoose. And we will also check in with her if there's been specific questions about recommendations for a resource, and we'll put that with the web page beside the recording, if indeed there is a recommendation that she can share. With that, Jolie Sasakamoose, I just want to say thank you so much. First of all, it was wonderful to have you join us again. We learn so much ourselves every time, and just the comments that are coming in from people, it's I know that your words were inspiring. Nobody is surprised, given your role and your writings about your knowledge. But I think what makes you such an amazing communicator and educator is your willingness to share personally, and to share your personal stories and narratives, and to bring to life the concepts that we hear. We hear the term, but when you talk to us, you bring it to life through lived examples. And I think that's so valuable. So thank you so much.
Thank you.
And we'll look forward. We're listening to all of those people who said, when is part 2 and how do we get more than an hour and a half? So we'll talk about all those things. With Dr. Jolie Sasakamoose. Okay, with that, thank you everybody. Be safe. Bye, Jolie. Keep doing your ballet.
Thank you. Have a great day, everyone.
Okay.